this data presented at the ASH meeting this past December in 2020, it was a very important update presentation on randomized trial of this new compound that was also approved last year, known as oral Decitabine Cedazuridine. The commercial name is called Incobi. This is an oral form of a hypomethylating agent, and the community knows that drugs like Decitabine and Azacitidine, the two commonly used hypomethylating agents, have been with us now for close to 2 decades. They are very frequently, of course, used for patients with MDS and AML because they are part of the standard of care. But they have a couple of issues. One is, of course, that they require chronic administration, meaning that unfortunately, as opposed to other types of chemotherapy, these drugs require basically use for as long as possible, particularly in myelodysplastic syndrome, where we published a number of years ago that if you stop these hypomethylating agents in patients in response, then there is a tendency for these patients to relapse. And unfortunately, it's very difficult today to treat patients with relapsed myelodysplastic syndrome after hypomethylating agent. So for many years, we've been kind of thinking and working on the development of an oral hypomethylating agent because we thought that that for sure will make the life of our patients much better. And it will have also significant implications in terms of research, future combinations, perhaps developing programs that are all based on oral treatments in combinations for our patients with MDS and hopefully in the future also for acute myelogenous leukemia. So this data from the presentation of Dr. Savona